Good morning, and welcome to the first ever episode of Tooth Teacher Tuesday. My name is Dr. Steven Zom, and I am coming to you from my dental practice, South Circle Dental Care, here in Indianapolis, Indiana. As the first episode of this video series, I thought it'd be appropriate to start off with an introduction as to the purpose of this video series. I feel, as dentists, that it is not only our responsibility to treat patients' oral conditions, but to also raise awareness and to educate patients so that they themselves can contribute to their own oral health by having a greater base of knowledge. I feel, especially in this era of pandemics and fake news, that there's a lot of misinformation out there, not only in dentistry, but in the medical world as a whole. So my goal with this web series is to provide a weekly, brief, 5-minute video addressing some topic for the week, some dental topic that chances are has come up in conversations that I've had with my own patients, and just addressing common misconceptions or myths in dentistry so that not only my own patients can be educated, but anyone else that tunes into this video series. Now, I don't have any grand delusions that I'm going to have hundreds of thousands of followers, but my hope is that even if just a handful of people tune in and learn something new each week, that they'll be able to improve their own oral health care, and again, that's part of our job in dentistry. So with this web series, as I said, each week will be about a 5-minute video talking about different topics. My goal is to just stick with the facts based on our current knowledge and understanding in dentistry, and also my own personal experiences, and to leave out any opinions or biases that I may have. I don't have any sponsors for this video series, so everything I say is based just on the science. And I will rarely make any kind of product endorsements. If I do make an endorsement, again, that's not because I'm being sponsored by anyone, but simply because in my experience I've had good success with a certain product or technique or whatever the topic may be. So with this web series, of course, I'm sure I'll have plenty of topics come up throughout the week with my own patients, but if you as a viewer have a question that you would like addressed in future videos, feel free to ask away in the comments, and I'll be happy to integrate that into our weekly video series. I'd like to finish off today's video by giving you kind of a grand tour of our office here in Indianapolis, and so I'll kind of take you through the office here. We'll just kind of work our way from the back to the front, give you a little behind the scenes view of our operations here. So this is our dental lab where we are able to do certain procedures. Some things we still send out to a professional dental lab, but some things we're able to do here in-house as well. This is our nitrous oxide or laughing gas closet. We do have the ability to administer various forms of sedation, including nitrous oxide, to help patients that have anxiety with dental work. And, a lot of us do. So that's one of the many benefits that we can offer to you here. Next, we have our sterilization center where we make sure any reusable dental equipment is properly sterilized so that it can be reused again and ensure a clean, sterile environment for our patients. Here in our operatories, we have various equipment, including our all-digital x-rays that are much more comfortable, much more convenient than the traditional film x-rays. They go right to our computer so that we can get instant results, and they have a clearer image than the old film x-rays, which aids us in having better diagnosis. We do have all of our operatories equipped with computers, since we are fully digital. And because we have these screens here, it also allows us the ability to stream various streaming platforms for any children that may be seen here, or for any longer appointments, to kind of keep you entertained during those appointments. Moving along here is our, what I would consider our crown jewel, is our CBCT and panoramic machine. What that means for the layperson is this machine allows us to take a variety of x-rays, 3D images that allow us to do a number of things, including diagnosing cracked teeth that might otherwise be difficult to diagnose. It also aids in our implant placement, our root canal or endodontic procedures, and then we even have the ability to do more specialized imaging, such as the TMJ or the jaw joint, imaging of that, imaging of the airways to help aid in diagnosis of sleep apnea, and even for patients who struggle with conventional cavity detection x-rays, we have the ability to do those on this machine for anyone that struggles with gagging or has a small mouth or otherwise struggles with conventional x-rays. So very proud of this machine. And then our final stop here, this is our reception area where you'll be greeted when you come to visit us. And in our reception area, it's a very large space, and we do have a little coffee station for anybody that might be interested. Now, you're probably asking yourself, why would a dentist want somebody to have coffee before their dental appointment? And, you know, that's a good question, because it probably doesn't make a whole lot of sense for us, but we're all human, and we know that some people need their coffee fix, so we do have that little accommodation as well. So I want to thank you for coming on this little tour of our facility, and want to thank you for tuning into the first of many episodes. This one's a little bit longer than the rest of them will be, but as I said before, welcome, and I look forward to hearing any topics of discussion that you would like to hear, and I hope you have a great Tuesday.